Hi, my name's Daniel Ray. I'm Director of Informatics here at University Hospital Birmingham. This is my second formal video diary for the eHealth Insider column. And one of the things that I want to talk to you today about is the information strategy. One of the really good things I hope that the information strategy will bring, and in discussions with the information centre it really sounds like it's going to come along, is being able to draw links between different elements of data within the whole of a patient's pathway. At the moment, the data sets that occur within NHS hospitals and providers is pretty well defined, and it's been there for a number of years. And we now have this ability, as a result of the SHMI, the new Summary Hospital Level Mortality Indicator, to link ONS data, so Office of National Statistics data, to the HES data, the inpatient provider data, which means that we can, from secondary care onwards, link together the whole of a patient's pathway. So any interaction that they have with secondary care, and then how long they survive, so looking at outcomes for patients over a longer period of time. But I think that what also needs to happen, and two of the big elements that are missing that here at UHB we've been able to build in, and the Information Centre is building in nationally, is patient experience data. So we have around 40% of our inpatients feedback on food, care, attitude and cleanliness. And on a national scale that's starting to happen with PROMS information. So really being able to triangulate secondary care and long-term outcomes for the patient. But the big element that's missing really to be linked into HES is GP primary care data. GPs are advanced in the electronic systems that they use, but up until this point there's not been linkage universally across England of GP data and secondary care data. I'm just going to give you an example of something that we've done locally. So again, in the work that we've done with the Information Centre, here we've looked at esophageal cancer and looked at what the survival rates are nationally. So on this top left hand corner here, I'm just going to highlight the whole of England, and on the right hand side we've got performance by trust, and this is around identifying where the patient is first diagnosed, so where they present in outpatients or as a day case and are diagnosed as having carcinoma of the esophagus, and then tracking those who have an esophagectomy, but fundamentally looking at their 3-year long-term outcome. So I'm just going to highlight a couple of trusts here, one right at the top, which is UCL, and then a couple that are just near the bottom. And then underneath you can see the Kaplan-Meier plot curve. And the punchline to this is, dependent upon the organisation that you present at, is that at the end of 3 years there's around a 65% chance of being alive. And if you present to a couple of other organisations across England, there's only around a 20% chance of being alive. So a huge disparity in terms of long-term outcome and presentation. And we're doing some work to understand whether this points towards a surgical intervention, or whether it's the identification in primary care in getting the patient into secondary care. But this is an example using the national data set of where you can link together HES data and ONS to really start to look at long-term outcomes. So as part of the information revolution, that's where I hope national data set collection is going, which is about linkage, being able to understand how whole health economies perform holistically. Thank you very much for listening, and I hope to speak to you on the next video diary. Thanks.